Hello, I'm Dr. Ron Hansen, an ear, nose, and throat physician from Minnesota. A portion of my practice is devoted to working with sleep apnea patients, some of whom struggle to get consistent benefit from CPAP and are looking for a new solution. The following is an educational program about Inspire upper airway stimulation therapy, an FDA-approved treatment that is clinically proven to significantly reduce sleep apnea events and snoring and improve quality of life. In this program, you'll meet 4 people who treat their sleep apnea with Inspire therapy and hear firsthand what it's meant to them and to their families.
I used to come home from work and sometimes the littlest things would just create that mood for me. And Dad, what's wrong? Honey, what's wrong? Nothing's wrong. Nothing's wrong. You're just irritable all the time.
My head just felt like I was always in a fog. If I was going to drive 30, 40 miles and I was by myself, I would probably have to pull over and take a nap on the way because I could not stay awake to drive that far.
I would commute in with several other women and driving on the highway when it was my week to drive. There are times when you're going 60, 65 miles an hour on the highway, and I knew if I could just close my eyes, just for a minute or two, I'd feel a whole lot better.
I tell all my patients that it's important to get an effective treatment because untreated sleep apnea can have tremendous negative effects on brain and heart health. Patients will complain about poor memory and poor concentration. They're at higher risk for work and traffic accidents. Patients are more prone to develop high blood pressure, heart attacks, strokes, heart failure, and abnormal heart rhythms. So finding an effective treatment is really essential.
I was apparently snoring very loudly enough so that I'd wake up and my husband went up to the next level of the house into the farthest guest room he could get from me because I snored so loud.
I used to entertain some of my customers periodically. We'd take fishing trips. It was so bad no one would ever sleep in the room with me.
CPAP is an effective therapy for those people that can use it. However, studies have shown that about half the people that try CPAP either cannot tolerate it or are unable to get consistent benefit from it.
I tried, I think, maybe 6 or 8 different masks, different types, trying to get one that I could adapt to. I think the mask probably affected my sleeping more so than the sleep apnea, because I just simply could not adjust.
All the air that came in had to come out, and I was very, very conscious of that blowing on my husband. So I always made sure that I was either laying on my back or laying on the other side. It burned my nose and always had sores in my nose, and I don't think that I ever found a mask that I would say really fit. The CPAP had lots of issues for me.
Even with a full face mask and as tight as I could get it, you have air gaps. It's shooting out the side, it's shooting into your eye.
You end up tearing the mask off and just throwing it because it's like, it's not effective. It wasn't working. It was more of a pain than it was helpful. I keep the remote control right next to my bed. I simply just reach over and turn it on every night and go off to sleep 30 minutes later, and I don't wake up when it starts and activates. And very easy to use. It's like push a button and go to sleep.
Inspire therapy is a new treatment for obstructive sleep apnea. As a physician, what I really like about this therapy is that it addresses the root cause of the problem. During sleep, the muscles and soft tissues of the throat can relax, block the airway, and cause apnea events. The Inspire device delivers mild stimulation to these key airway muscles and gently moves the tongue and other soft tissues out of the airway so you can breathe at night. You can see in this animation what it looks like. The back of the airway is now clear and the patient can breathe during sleep. We're using proven technologies that are used every day with other similar medical devices, and now we're just applying them to treat sleep apnea. It's a very simple concept, and it's all under control of the patient with the sleep remote. You turn it on at night before you go to sleep and off when you wake up.
I just have the remote that turns it on and off, and when I first turn it on, it will just move my tongue one time like it would move it during the night, just to let me know that I have it on. And then it gives me half an hour to go to sleep.
It really is a matter of hitting a button at night. There's no strapping on a mask and trying to sleep in certain positions. It's a very simple way to live your life at this point.
It's more like an involuntary muscle movement. There's no pain associated with it at all. It's just simply the movement.
It's a way of life that's very simple to incorporate. It's like getting up and brushing your teeth every day.
Inspire therapy is for those patients who have moderate to severe obstructive sleep apnea, are unable to tolerate or get consistent benefit from CPAP, and are not significantly overweight. The first step for patients is to schedule a consultation with a doctor trained on Inspire therapy. This doctor will evaluate your overall health status, your sleep apnea treatment history, information from previous sleep studies, and perform a comprehensive examination of your airway anatomy. This information will help determine if you are a good candidate for Inspire therapy.
It just sounded too good to be true. And I think it is. I mean, it's true, but it's almost too good to be true.
I first heard about Inspire when I was reading a newspaper Saturday morning. I saw a very small article that just talked about being intolerant to a CPAP machine. And those were the key words that got me.
I first heard about Inspire therapy on the radio. I was at work. The radio was talking about people with obstructive sleep apnea who were on a CPAP and that were having difficulties. After about hearing this radio spot 4 times that day, I turned to my coworker and said, they're trying to reach me.
I think the tipping point was stop using the CPAP. It was an alternative that I wanted to do. It seemed a lot simpler. And it was nice to be part of something pioneering. Just getting away from that CPAP machine was my #1 thing.
After meeting with the physician about the Inspire implant, and I had 2 hours to drive home with my wife to discuss it, or rather to listen to her for 2 hours about it. She was sold on it immediately, which is very unusual. It's generally I'm the person, and I was very impressed, but I wanted to take the approach. I wanted to find out as much as I could.
Well, I had lots of issues with my CPAP machine. Forced myself to use it, but I had lots of issues with it. And I don't think it was a difficult decision at all. I just thoroughly am thankful for this implant, this Inspire implant. It's just been perfect.
It's important to make sure you have a good understanding of the Inspire procedure and also the safety and effectiveness information from the clinical trials. Inspire therapy works inside the body with a patient's natural breathing process. The system is placed under the skin of the neck and chest through 3 small incisions. The device is turned on by a patient with the sleep remote seen here. After the patient falls asleep, the system syncs with breathing patterns and then delivers mild stimulation to key muscles of the airway throughout the night to keep the breathing passages open. Inspire is typically inserted during an outpatient procedure under a general anesthetic. Patients will experience some mild discomfort and swelling at the incision sites for a few days after the procedure. This is typically managed with over-the-counter pain medications such as ibuprofen or Tylenol. Patients can return to a regular diet and most activities of daily living immediately after the procedure. Inspire therapy was approved by the FDA based on safety and efficacy data obtained from clinical trials. The STAR clinical trial was conducted at over 20 leading medical centers across the United States and Europe, and results were published in the New England Journal of Medicine. Patients experienced significant reductions in apnea events, meaningful improvements in quality of life, and significant reductions in snoring as reported by their bed partners. You will have a full discussion about all the risks and benefits of the Inspire procedure with your Inspire-trained doctor. Indications, contraindications, and important safety information can be found online by visiting www.inspiresleep.com. Inspire therapy is FDA approved and clinically proven to be an effective therapy for treating obstructive sleep apnea. Currently, the therapy is being reviewed and approved by insurance companies on a patient-by-patient basis. This process is very common for most new therapies. Your doctor's office that has been trained on Inspire therapy will file this request for insurance coverage on your behalf. A significant number of insurance companies, including Medicare, have already paid for Inspire therapy. Inspire therapy is also on the federal supply schedule, which makes the therapy accessible to veterans and military personnel. The first step is to see if you qualify for Inspire therapy, and then it's our job as physicians to begin the insurance approval process on your behalf.
In the past, you woke up, it was just like a blank night, and now to have a dream and to realize you're dreaming, and that just was giving me the clue, okay, I'm sleeping good, I'm sleeping better.
It's a common story that I hear is that they didn't dream before, but they do now, and all of a sudden you get the implant in and you start dreaming, which really is sort of a clinical measure that you're getting into that deep REM, restful stage of sleep.
I couldn't even play with my granddaughter because I was too tired, and you know, those kind of things just don't happen anymore. I just am awake for what I need to be awake for and for what I want to be awake for, and I'm very thankful.
This is so important. It really comes down to the quality of life issue. It's not about how long we're going to live, how well we're going to live, but it's living efficiently, effectively, and happy.
I wake up every morning, I am well rested. I turn off my device, I'm ready to face the world. I don't need to fall asleep at my desk anymore. I don't look forward to a nap at lunch or a nap when I get home. I'm ready to go for the whole day.
I can't remember the last time I took an afternoon nap. I mean, since this device, I've never had to take a Saturday afternoon. I've never had to come home from work and have to take a nap because of this. This device has helped that much.
I just thought tired was part of life. I think I've always been tired. I had always been tired. Ever since we've been married, he's been telling me that I didn't sleep at night, that I would wake up. So I've always been tired. I didn't know any better. Life is good now.